Okay, this is part 2 of how to treat neck pain. This is getting a little bit more advanced. The key here is learning to get to the root source of the problem. Last time we talked how to treat the trapezius, how to treat the levator scapula muscle using the technique that we use here. The other part of the body intelligence technique is learning the meridians of the body and how they interact with this point here, because if that's where you have pain, it may not be coming from there. It's the end of the pain, but the beginning of the pain may be coming from the ribs, from like an old car injury. Car injuries or falls are notorious for getting the ribs because the heavy things in the body is what causes the expansion of the heart, liver, and spleen to expand out on the ribs, pushes the ribs out, causes a tension pattern, and then it pulls down like this on the neck. So imagine this was the body. If you have tension in the heart because of that old car injury, it'll pull tension on the neck, and this is the source of the neck or source of the shoulder pain. So you got to release the ribs. So the way you do that is through pressure points. I use different pressure points on the body to find out where it's at, and there's multiple. There's infinite amount of pressure points, but the closer you get to the point that needs it, the better. And this takes a lot of practice, but generally what you want to do is basically poke and prod. In your situation, you have to poke and prod to find it. I use a lot of muscle testing in my office, which helps me to tailor it and laser in. That's for another video, and it takes practice to do the muscle testing. But in your situation, if you want to take a look at some of the meridians, look at it on Google. You could, for example, look up at body meridians, Google body meridians, and you'll see different pathways that run up and down the body to go through this point. And you can look at all those meridians that go through this point and start treating points along that meridian. It could be along the arm. There's arm meridians that go up to this trapezius and neck pain muscle. There's the gallbladder meridian that goes up this way and goes through this muscle. And so you have to treat throughout the whole pathway. Where I think that you probably would need to come in is probably doing the cranial work. But you can start, this is another video now, is the cranial work, but I'm just trying to give you an idea of how you fix the cause of the problem, because it just may not be here. It may be along the meridian, or it's basically an electrical pathway of the body. And so those pathways are like roads. So if you have a traffic jam on a part of the road, it may show up right here as pain, but the traffic jam may be down here, or maybe in the head, part of that same pathway. So it's a little bit ethereal, I apologize, but if you look at the meridians, you'll see, just look at the gallbladder meridian. It goes from here, down the neck, down through the gallbladder area, not gallbladder, to the side of the ribs, all the way down to the pinky toe. So you have to analyze the whole path. And that's when you can get some better results, because now you're not only treating for local pain, you're treating for where that pain may be coming from. So basically, you look throughout the whole area and kind of like poke and prod and see if you have tender points. And if you find a tender point, oh, that's a little bit more sensitive, and you compare it to the other side, oh yeah, it's more sensitive than this side. Well, that may be an active hot point. So I just put pressure on there for 20 seconds or until the tenderness goes down. The longer the better, but you can overdo it. So just work on it until maybe at the very most 1 minute, until the pressure or the tenderness goes down. And then you keep going to the next point. Just keep kind of looking along that meridian, that chart in Google, and you can see all the different various points which you need to check. So that's my hot tip for you today. It's great to be able to get to the root of any problem so that it doesn't come back. God bless you. My name is Dr. Paul. I'll see you in the next video.